So now I'm delighted to introduce Nan McCarran, Dr. John Morris, Katie Baxter, and John McCusker, who are members of the My Comrade Plus PPI group. I'd also like to introduce Colette Kerwin, who is the research team member with the My Comrade Plus study that was involved in this presentation. So this is a PPI partnership that ensures the perspectives of living with multimorbidities are heard and reflected in the development and dissemination of this cross-border trial. The My Comrade Plus PPI group and study were also a joint winner of the PPI in Excellence Awards at NUI Galway. So thanks very much to everyone for recording this presentation, and we will head into it now.
Good afternoon. My name is Nan. Thank you to the PPI Conference Committee for inviting us, the My Comrade PPI panel, to speak today at this important conference about our involvement with the My Comrade study. I'd like to take this opportunity on behalf of the group to say thank you to NUIG Public Advisory Panel and NUIG Ignite for our PPI Excellence in Research Award earlier this year, and to Kyton, who support the My Comrade study. I'll open this presentation with a brief overview of the My Comrade study and highlight the aim of our PPI panel. Morris will present on the setup of our group, Katie on our activities to date, and John on our challenges and learnings. But first, I'd like to share with you a little slice of my own story. I have been living with multimorbidity and polypharmacy for nearly 23 years, starting with a bone marrow transplant in 1998. I survived a hemoglobin of 2 in 2003, which I understood to be pretty unique. On the positive side, without all the brilliant medics and support staff in London, Scotland and Northern Ireland hospitals, I would not be here today. On the other side of this coin, I have been on the receiving end of appointment errors, a lack of communication, GP prescription errors, pharmacy discrepancies, and many more. In 2003, one of my early hospital files went missing and was never recovered. Over the years, I've developed a good knowledge of my complex medical history, and through necessity, I have become my own healthcare manager, at times bridging the communication gap between consultants. I was very happy to join the My Comrade PPI panel because it was very relevant to me and has given me a voice that would otherwise not be heard. The My Comrade study is a pilot cluster randomised controlled trial that examines the effect of an intervention that supports GPs and practice-based pharmacists in their review and management of multiple medications prescribed for patients with multimorbidities. It is a cross-border study between Northern Ireland and the Republic of Ireland. The core purpose of our PPI partnership with the My Comrade study was to ensure that the perspectives of persons living with multimorbidities and polypharmacy were heard and reflected in the development and the sharing of the study. Our broader ambition is to positively and effectively impact healthcare policies for people living with multimorbidities on the island of Ireland and hopefully beyond our borders too. Our PPI panel has found the My Comrade research team to be very professional, personable, and easy to work with, which effectively sets the stage for us to play our part. Thank you. I'd like to hand you over now to Dr. Morris Brown.
Thank you, Nan. My name is Dr. Morris Brown. I've been a GP for over 20 years, and after leaving my practice in Castlederg, I worked as medical advisor at the Western Health and Social Services Board, where I was responsible for primary care in the area, including GP prescribing. These two occupations give me a knowledge and background into research, and I was interested in being involved in the My Comrade Plus study and keen to help in any way I could. In addition, I am living with multiple long-term medical conditions, and I'm taking more than 10 medications per day. Involvement with the My Comrade Plus study so far has been a great experience for me. I have found it very interesting and have been able to increase my knowledge of modern research techniques. Since March 2020, I've been unable to socialise face-to-face in the normal way, and our frequent Zoom meetings with our group of knowledgeable, pleasant and respectful members have gone some way to filling this gap. I now wish to describe our PPI partnership with the My Comrade Plus study. My initial contact in late 2019 with the My Comrade Plus research associate, Colette, was initiated through John McCusker, Secretary of the Rotary Club of Strabane, Lifford, who later also became a member of the group. The club has members from both sides of the border. After discussion at a club meeting, it was agreed that I, Dr. Morris Brown, would be the best person in the club to take this forward. I first met with Colette in Lifford on the 16th of January 2020, and she explained the details of the study and the part a PPI partnership would play in it. I then, with Colette's assistance, managed to get a group of 4 established. Our 4 members, 2 females, Nan and Katie, and 2 males, John and myself, as cross-border representatives, have substantial experience of life, have direct or indirect contact, exposure or experience to living with multiple long-term health conditions and prescribed multiple medications. The first meeting of our full member group planned for the 18th of March 2020 infamously coincided with the initial COVID lockdown. This meeting and all subsequent meetings were conducted virtually via Zoom, and communication between the researchers and the PPI partnership was by email. This means of communication proved to be very successful and allowed us together to establish a great deal in a short period of time. My ambition for the study is that the findings of this research should be shared extensively with GPs, pharmacists, and hospital consultants through their various journals and ongoing education programs to improve the care of patients with multiple long-term medical conditions and taking many different medications. Thank you, and I now hand over to Katie.
Thanks, Morris. Good afternoon, everyone. I'm Katie, and I've worked in a number of roles in a GP practice in Northern Ireland for 40 years. And most recently, prior to my retirement, I was practice and finance manager. When invited to take part in this My Comrade Plus PPI group, I was very interested, especially as I felt my work experience had relevance to the area of study, an area which had the potential for improvement in patient care. I would like to give you an insight into our PPI panel involvement with the My Comrade research team. Our involvement to date has mainly related to giving our perspective and advising the research team with regard to 1, the interview invite letter for patient participants, 2, the interview questions, and 3, the initial analytical framework from the interview transcripts. With the invite letter, we recommended changes of some of the wording to improve clarity and reduce any confusion and alleviate potential anxiety. We also recommended including participants' GP details, which we believed would encourage patients to seek further reassurance from someone they trusted, should they wish to. Again, with the interview questions, we recommended changes in the wording to improve clarity. We also gave our recommendations on prioritising and ordering of the questions and exclusion of those we thought to be less relevant. Because of COVID-19, we also suggested the inclusion of some questions around the impact of the pandemic on patients and their access to care. Finally, we contributed to developing the initial, what was called the analytical framework in interpreting the interviews. Following a training session on Zoom, each of us was involved separately in reading an interview, identifying what we thought were the key points the participant was saying and adding a description to it. Afterwards, we came together as a group with the My Comrade research team to discuss and agree on what each of us thought. We finished with an agreed list of key points and descriptions. This process was very new to all members of the group, and therefore we relied greatly on our research team, Lisa and Colette, for guidance. At our last Zoom meeting, Colette brought us up to date with the coding process. The group's next contribution is to discuss the dissemination of the study findings, that is, what to share, how to do that, and with whom it is to be shared. This study has been most interesting and purposeful, and I certainly have enjoyed and benefit from being part of it. John will now tell us of some of the challenges we faced. Thank you.
Thank you, Katie. As Katie said, my name is John McCosker. I am a person passionate about giving service and have always been drawn to support organisations that give service to the community. Numbered among these were Roundtable, the Northern Ireland Fire Authority, Department of Health and Social Services Appeal Tribunal, and Rotary. The ethos of Roundtable and Rotary is service above self. This ethos was also implicit in the other two organisations, which were voluntary and unpaid. My personal health problems and relationships with GPs and consultants encouraged my involvement as a member of the My Comrade Study PPI panel. This experience has given me the realisation there can be better explanation to patients by their GPs of medical diagnosis, medications prescribed, and their effects. I myself resorted to self-management of my own conditions from my interpretation of GPs and consultants' discussions and comments. My experience highlighted to me the need for patients to have a clearer understanding and regular review of their medical conditions and explanation of medication and treatment prescribed by consultants and particularly by GPs, all of which seem to relate to the purpose of the My Comrade Plus study. I am presenting here today on the strengths and challenges as we as a group experience from being part of the My Comrade Plus PPI panel. Key strengths and motivators were the relevance and variance of the personal, occupational background and life experiences of every member of the team contributed immensely to the substance of the study. Being part of a group of people who were also of a similar mind and were willing to listen as well as give their opinion. Being part of a team where the participants had mutual respect and dominance was absent, that encouraged full inclusivity. Support, assistance and leadership from the My Comrade Plus research team was invaluable. The ability of the whole team to adapt to the new norm of collaborating via Zoom meetings because of COVID. The challenges in the study, involvement as a member of a PPI panel for the first time for any study is daunting. My professional life has been very practical and always required purpose and strategy to be clearly defined. Once getting to grips with the purpose of the My Comrade Plus study and the purpose of our PPI group, the strategy for engagement emerged, giving sight of a pathway to making a meaningful contribution to the study. In particular, coding the interview was challenging. At first, the coding of the interviews for My Comrade study was an unusual experience, and it required specific focus, interpretation, and concentration. The need to remain objective and confine interpretation to the sentiments of the patients in their interviews required skills that were vital to the exercise. The positive feedback we received from the My Comrade Plus study team indicated we accomplished this task well. Our other most prominent challenge was engaging with and working remotely. Working remotely due to COVID-19 without face-to-face consultations with the entire group and the My Comrade research team seemed somewhat abstract at the beginning. There was a need to realise that despite having to rely on Zoom and email, this was a real-world exercise to remain focused on our objective and to manage it. In conclusion, I feel I need to congratulate the members of the My Comrade Plus research team who led our group in the exercises throughout the study and in the formulation of the outcomes, and they are Colette Kirwan, Emma Carr, Lisa Hines, and Andrew Murphy, PPA of My Comrade Plus study. Our group thanks you for your courtesy, assistance, and the pleasure of your company on this study. Also, as highlighted by Nan at the opening of the presentation, our thanks to Kaiton for their funding and to NUIG Ignite for our award, and to NUIG PPA Conference Committee for inviting us to speak here today. On behalf of the entire group, I thank you very much.